Hi everyone, welcome back. I'm Jin Su. Let's continue to learn the unit of medication. In this session, we will learn intravenous infusion in intravenous therapy. The learning objectives of this session are, by the end of the session, you will be able to describe the definition of intravenous infusion, state the purpose and indication for intravenous infusion, verbalize the steps used in initiating an intravenous infusion, identify infusion complications, and describe the interventions. In the first part of this session, I will focus on the definition, the purpose, and so on. In next part, I will focus on the implementation of IV. Intravenous therapy is the therapy that delivers fluids directly into a vein. The intravenous route of administration can be used both for injections using a syringe at higher pressure as well as for infusions, typically using only the pressure supplied by gravity. The intravenous route is the fastest way to deliver medications and fluid replacement throughout the body because they are introduced directly into the circulation. Intravenous therapy may be used for fluid volume replacement, to correct electrolyte imbalances, to deliver medications, and for blood transfusions. The type of access. A peripheral intravenous line is used on peripheral veins, the veins in the arms, hands, legs, and feet. This is the most common type of IV therapy used. Central IV lines have their catheters that are advanced through a vein and empty into a large central vein, usually the superior vena cava, inferior vena cava, or even the right atrium of the heart. Indications for a central line over the more common peripheral IV line are usually the poor peripheral venous access for a PIV, or when patients would require infusions over a prolonged period. For example, when the substances to be administered could irritate the blood vessel lining, such as some chemotherapy regimens. Medical use. Substances that may be infused intravenous include volume expanders, blood-based products, blood substitutions, medications, and nutrition. The IV push. Little different from intravenous infusion, IV push is the rapid administration of a small volume of medication, a one-time dose into the patient's vein via a previously inserted intravenous catheter. This method is used when a rapid response to a medication is required. IV infusion is a controlled administration of medication into patient's bloodstream over time. IV infusion may use either gravity or a pump to infuse medication through the catheter. Both pump infusion and drip infusion are the most common methods used in China. Pump infusion. The pump is attached to the IV line and sends medication and a solution, such as sterile saline, into the catheter in a slow, steady manner. Pumps may be used when the medication dosage must be precise and controlled. Drip infusion. This method adopts gravity to deliver a constant amount of medication over a set period. The medication and the solution drop from a bag or bottle into the catheter. Intravenous infusion is usually given in the arm through the medium basilic or medium cephalic vein, but veins at other sites may also be used. When choosing the proper site, nurses should consider the suitable location. The common veins used in adults are median cubital, cephalic vein, medial vein of forearm. It's mostly used for drawing blood samples or IV push. Dorsal venous network is the first choice for IV infusion for adults. The common veins used in infants are scalp veins such as frontal vein, superficial temporal vein, and etc. But scalp veins may not be the first choice for children. Distal portion of the arm or dorsal foot veins can also be used for IV infusion in toddlers. The general consideration of choosing IV infusion sites can be: use hand and forearm veins. Do not perform venipuncture in lower extremities in adults due to the risk of phlebitis. Choose sites about infiltration, phlebitis, or hematomas, or away from traumatized tissue. Avoid using an arm with diminished sensation or mobility, such as neurological impairment, burn area, and amputated limb. Do not use affected arm of a post-mastectomy with lymph nodes removal. If the IV is to be inserted pre-operatively, the location is determined by the type of surgery. Avoid previously used veins. Select a vein that is large enough to allow adequate blood flow around the catheter. Choose soft and bouncy veins. Avoid hard, cord-like or discolored veins, bruised area, and tender, painful veins. Avoid antecubital veins for routine IV therapy. Okay, that's all for this part. Let's learn the procedure of IV infusion in next part of this session. Thank you for joining us. See you next time.